Our video today starts with some data straight from the Center for Disease Control and Prevention. This is all about a study they initiated back in 1985 tracking obesity trends across the nation. Its intent is in keeping an eye on the percentage of U.S. adults considered obese. Now, if you're new to this, obesity is clinically defined as having a body mass index, BMI, over 30. Now, the BMI system isn't perfect. It doesn't consider muscle mass, for instance, but it gives us a ballpark figure to work with and is suitable to large populations. Let's take a visual tour through time. In 1994, the first year with all states represented, our map shows less than 15% obesity rates across the U.S. Here, we need a pause. In 2011, the CDC changed the methodology of tracking. The maps shown until now serve to illustrate the story of the nation's obesity patterns, but are not going to be used for apple-to-apple comparisons with this new data. But as we fast forward, you can already note that things start looking grim. This new dataset, from 2011, starts us off with the states doing best, averaging adult obesity at 20 to 25%. Fast forward to our latest data from 2021 and the scenario is quite shocking, with some states seeing obesity rates higher than 40%. See how that dark red color is spreading? Our challenge now isn't just reversing this trend, but even just slowing it down. We're looking at an obesity epidemic, folks. However, the situation becomes murkier when we peel back the layers. When we view this issue through the lens of race, we find notable disparities. Data from 2016 to 2018 reveals that obesity rates amongst non-Hispanic Black adults were significantly higher than among non-Hispanic white adults. The same data trend is unfavorable when comparing non-Hispanic white to Hispanic adults in the U.S., demonstrating yet another disparity in data. This imbalance demonstrates that access to health-promoting services and care isn't distributed equally. Now, it's crucial to stress that obesity is multifactorial, and not merely a result of a lack of willpower or personal failing. It's a complicated issue interwoven with various factors. Genetics plays a part, where certain genes can predispose individuals to gain weight. The environment also has a role. Areas with a lack of safe, accessible places for physical activity, or where healthy food options are limited, can contribute to higher obesity rates. Mental health factors, such as stress, anxiety, and depression, can also lead to weight gain. Socioeconomic status is another key player, with low-income individuals often having less access to healthy food options or healthcare services. Let's pause and reflect. In our modern society, we've become somewhat infatuated with quick, one-size-fits-all solutions to our problems. We eagerly follow the latest diet trends making headlines or the newest workout craze sweeping across social media. Complex, multifactorial problems like chronic disease and obesity require multi-layered approaches, not singular solutions. Our health is simultaneously influenced by a range of factors: our genetics, environment, mental health, socioeconomic status, access to healthcare and healthy food, and, crucially, our physical activity levels. This complexity is part of the human condition, but it need not paralyze us into inaction. As we ponder the way forward, a critical question arises: which determinant of health is most impactful on overall health, disease status, and mortality? Do all determinants carry equal weight? Are we perhaps prioritizing some aspects while neglecting others? Steven Blair, a renowned epidemiologist, delves into this question in his position statement titled, Physical Inactivity, the Biggest Public Health Problem of the 21st Century. His research underscores that while many factors determine health, they are not all equally influential. Among various health determinants, low cardiorespiratory fitness, smoking, hypertension, high cholesterol, diabetes, obesity, Blair reveals that one factor, low cardiorespiratory fitness, significantly outstrips the others as a predictor of mortality. Surprisingly, obesity accounted for only around 2% to 3% of deaths in men and women, respectively. The research also demonstrated that an individual with a healthy BMI but low physical activity was at a higher risk of dying from cardiovascular disease than an obese individual with high cardiorespiratory fitness. This finding upends conventional wisdom that equates thinness with fitness and obesity with poor health. It underscores that obesity should not be the sole or even most powerful indicator of health and mortality. Further studies have reinforced the importance of physical activity. A study from Australia found that individuals who watch TV for 5 or more hours a day tend to live 5 years less than their active counterparts. A study from Norway found that transitioning from low to high cardiorespiratory fitness in midlife can add those 5 years back. The benefits of physical activity apply to us all, regardless of our age. It's been recognized as such since 1958 with the famous London bus study. That study found that bus conductors, who were much more physically active than the bus drivers, had a significantly lower incidence of cardiovascular disease. So, let's break free from the limitations of our modern quick-fix mindset. Let's challenge the misconceptions and harness the power of physical activity. Let's focus on enhancing our cardiorespiratory fitness rather than obsessing over the latest diet or workout fad. In the spirit of exercise is medicine, let's commit to integrating more physical activity into our daily lives. Let's advocate for it within our communities and spread this invaluable knowledge. Remember, it's not just about the numbers on a scale or your BMI. It's about getting your body moving and improving your cardiorespiratory fitness. With each step, lift, or swim, you're reducing your risk of chronic disease and mortality. If you enjoyed this video and found it informative, don't forget to like it, subscribe to our channel, and share it with others who might benefit. Hit the notification bell so you won't miss any of our future discussions.